Hello coders, today discuss ICT Tension Part 1 Introduction for Convention. First time to see channel, please subscribe my channel. Okay, let us discuss alphabetic index, table or list. Alphabetic index arranged in alphabetical order. This is used to search for codes. It contains disease and injuries, external causes, neoplasms, cancer table, drugs, chemicals. So alphabetic index mainly arranged in alphabetical order. In this alphabetic index, we search codes. Tabular list. Tabular list organized chapter wise. So use it to verify and confirm the final code. So finally, index find the code. Tabular list confirm the code. Next, format and structure of code. So in formats, minimum our ICD codes minimum 3 characters, maximum 7 characters. So in level of category 1, 3 categories, category, subcategory, code. So category 3 characters, subcategory 4 to 5 characters, code 3 to 7 characters. So example A00, this is category. A00.1, this is subcategory. So important rule, if seventh character is required, it must be used. Otherwise, the code is invalid. So 3 is category, 4 to 7 is detail. Use of codes reporting. Always report full codes. Do not report only category or subcategory code. If seventh category is required, must be added. So use full codes only. Placeholder X. The letter X is used as a placeholder. Maintains for future code expansion. For example, T36, T50, ordering code. Rule. If X is required but not used, code becomes invalid. So X fill the empty position. Seventh character, this is very important. Used mainly in injury codes. So in seventh character, A denotes initial encounter, D denotes subsequent encounter, S sequela, later effect. Root rules always placed in the last position for seventh character A, D, or S. Anyone. So if code has fewer than 6 characters, add X before the seventh character. So we must present total 7 characters. Only for 6 characters is there, seventh character is not there. So the 6 characters fill to X and next seventh character is add A, B, S, whatever may be. So seventh character is encounter type. Use X is position is empty. Next, abbreviations NEC NOS. NEC means not elsewhere classifiable. So documentation is specific, exact code is does not exist. So it means other specified are specified. NOS means not otherwise specified. So document lacks of detail means unspecified. So NEC means information available but not exact code. NOS information not specified. So finally NEC means details available. NOS details missing. Next punctuations. In this punctuation symbols, manifestation code, brackets, optional, non-existent code, comma, colon are there. Meaning of and are and are. Both conditions presence or so either condition is specified. Same codes may be applied for and other unspecified codes. Other specified means NEC. Previously we discussed this NEC, not elsewhere class level. Provider gives full details. Exact code available. So we mentioned NEC. Unspecified means NOS. Provided documentation is incomplete. So use unspecified codes only when information is not available. Includes codes. Provide examples or explanation of conditions included in the code. So includes means example list, inclusion terms, Condition listed under a code, synonym or related conditions, not a complete list. So inclusion is similar conditions. So excludes, no, this is very, very important. Excludes are two types, excludes one, excludes two. Excludes one means not coded here. Two codes cannot be used together. So exclude one means not coded here. Two codes cannot be used together. So example, conjunction versus acquired condition. Exclude two means not included here. So conditions are separate. Both codes may be used if patient has both conditions. So why meaning exclude one do not code together. Exclude two can code together. So etiology manifestation convention, this is also very important. Etiology means underlying the causes. Manifestation means resulting the condition. So example, diabetic neuropathy, Parkinson disease, dementia. So main rule, etiology first, manifestation second. So code first. Code the underlying disease first. Use additional code, add a second code, the manifestation extra condition. If disease classified elsewhere, so indicate the manifestation code cannot be used as a first listed code. So alphabetic index tip, first code etiology, code in brackets manifestation. Brackets code always second. Keep in mind. Okay, example Parkinson disease with dementia. G20 caused by etiology. F02 effect manifestation. Order G22 F02. Meaning of and definition. In ICD 10 and appearing in code title should be interpreted as and or are. This means both conditions may be present or only one condition may be present. The same code still apply. So example A18.0 tuberculosis of bones and joints. These codes include tuberculosis of bones, tuberculosis of joints, tuberculosis bones and joints. So all are classified under A18.0. So shortcut what is this one? And is equal to and or are. Meaning of with, very important, this is also. The word with or in means associated with, due to. So these words may be appear in code titles, alphabetic index, main term or subterm, instructional notes, the table or list. Keyword, as it in same assumes a casual relationship between conditions connected by the word with. The conditions are coded or related. So even the provider does not explicitly document the relationship. So exception, do not assume the relationship between documentation clearly state conditions unrelated or another guidelines require documented linkage. For example, sepsis guidelines requiring confirmed organ by dysfunction linkage. So when provider documentation is required, provider must be linked codes when classification do not contact then using with. Guidelines specifically require documentation. So important index rule, if alphabetic index, the word with appears immediately after the main term subterm. If it is not arranged alphabetically. Shortcut with assume the relationship unless the started otherwise. Next, C and C also instruction. C instruction meaning directs the coder to another main term. You must be go the referential term, find the correct code. So mandatory instruction. So example concept hypertension. See also procedure blood. You must check that referential term. See also instruction meaning suggest another possible main term may provide additional coding options. Optional instruction. You do not need to follow if the organism term already gives the correct code. So easy difference means C must be followed. C also is optional. Shortcut C, go the other, required. C also check if needed. So and equal and on with assume the relationship. C mandatory reference. C also optional reference. Code also no. Two codes may be required. Order is not specified. Depends on clinical situation, patient condition. Code also use two codes. Order flexible. Default code. Code listed next to main term alphabetic index represent most common condition or unspecified condition. Used when provider give no further detail. Example appendix only mention. Use default code. So no details, default code. So code assignment, clinical criteria. Coding is based on the provider doctor diagnosis statement, not based on lab values not allowed. So if documents conflicts exist, query to the provider. So doctor documents coder assignments code. So index is fine, tabular is confirmed, full code is always cause effect, X full code, doctor documentation final authority. So once again we repeat briefly. Alphabetic index mention find the code, tabular means confirm the code. Format structure minimum 3 characters in ICD code, maximum 7 characters. Use of code, full code if applied. Placeholder means it fill the empty position. Seventh character is that encounter type. NEC means details are available. NOS means details are missing. Punctuation brackets explanation optional words needed for more terms, commas, other alternative. And means same code may apply. Other unspecified means unspecified code only when information is not available. Unspecified. So include note means example list. Includes means example list. Includes term means similar condition. Excludes means exclude one do not go together. Exclude two means go together. Can go together. So etiology manifestation. Etiology means underlying the causes. Manifestation means resulting in the condition. So etiology first, manifestation second. Next, meaning of and both condition may be present or only one condition may be present. You use the and. So with means assume the relationship. C and also that denotes C must follow. C also is optional. So code also use two codes. Default code means default code, no details. Code assignment clinical criteria. Doctor documents code assignment. So I hopefully please subscribe my channel. First time ever seen. So thank you.